now.
So in this second part, we really start to look at the third principle. If you recall from the first part of the presentation, we looked at what? We looked at assessing for areas of risk and need, and we looked at increasing one's intrinsic motivation to succeed. In this next part, we're going to look at principle number 3 of the principles of effective intervention, which is targeting the intervention. It's very important that we target the intervention. There are 5 subcategories: the risk principle, the need principle, the responsivity principle, which I've spoken about, which is the who, the what, and the how of corrective interventions or correctional interventions. But we also want to briefly cover dosage, which is how much intervention, and of course the treatment principle. And those are 2 things that I'll get to in possibly part 3 of this presentation. So let's take a look at this next slide here. How safe is low-intensity supervision for low-risk offenders? There was a study done in Philadelphia about 6-7 years ago, and it looked at the Philadelphia probation population, and it specifically looked at low-risk caseloads and low-risk individuals. And when I talk about low risk, I'm not talking about how dangerous the person is. I'm talking about their propensity to recidivate. So we have a randomized controlled trial, which, if you remember, is the gold standard of research. Randomized controlled trial evaluation of Philadelphia probation, assigning low risk to large caseloads or regular caseloads. Low risk on exclusive caseloads were seen about half as often, but there was no difference. This was the main finding. There was no difference in the prevalence, frequency, seriousness, and time to failure of arrests for new crimes. That time to failure is, said another way, is how long the person was at risk, how long the person was on the streets before they were arrested for a new crime. And that's a significant finding, that what we oftentimes do with the low-risk offender is provide too much intervention, and that actually increases their risk. And this study found the opposite, that there was no difference in the prevalence, frequency, seriousness, and time to failure of arrest for new rates for low-risk offenders. Significant finding. So, to further illustrate that, you'll see a slide up there now, and it looks at 4 meta-analysis from 1971, 79, 80, and 2000. And if you look at the risk level of the individuals and the level of treatment, that means the level of intervention, low-risk offenders through 30 years of research, if you provide intensive intervention to low-risk offenders, they will recidivate at higher rates than if you provide minimal intervention to low-risk offenders. Subsequently, with your high-risk offenders, the opposite was found. So what that tells me as a practitioner is that I need to focus my efforts. I need to target my intervention on high-risk offenders, meaning those offenders that are more likely to recidivate. And that's an important distinction, because what I end up doing when I provide too much intervention to low-risk offenders, I increase their risk. So another way of looking at that is, what happens when you put a low-risk offender into a high-risk situation, into a high-risk prison with high-risk individuals? You increase their risk. Yeah, that's something that we always need to consider. We cannot intervene too much with low-risk offenders, and we need to focus our interventions on medium and high-risk offenders. Need principle: target the intervention to criminogenic needs. Criminogenic versus non-criminogenic. What do I mean by criminogenic? Those are dynamic needs. That means they are needs that can be changed through correctional interventions. Dynamic needs are related to one's likelihood of offending versus non-criminogenic needs, needs not related to one's likelihood of reoffending. And that's an important distinction. You have criminogenic needs, those needs that are related to reoffending and can be changed through interventions, and non-criminogenic needs, needs that are not related to one's likelihood of reoffending. Now, here are the areas of criminogenic need. You'll see the top areas of criminogenic need are one's companions. Remember when you were a young person and your father or mother or someone always said to you, pick your friends wisely? Yeah. Who you hang around with, your friends, will influence whether or not you're going to get into trouble or not, especially if they're bad friends. Your attitudes, your antisocial attitudes, your antisocial values, your personality, your antisocial personality. These are the top 3 drivers of recidivism. People are criminals because they think like criminals. There are lesser criminogenic needs related to family, substance abuse, leisure and recreation time, how one uses their leisure and recreation time, and their education and employment. I'll have some a couple slides on some common myths that we see in community supervision these days around substance abuse and employment and education. But suffice to say, the top 3 needs, criminogenic needs, the top 3 drivers of recidivism is antisocial attitudes, values, and beliefs, companions, and antisocial personality traits. Here's a myth. Employment and substance abuse are 2 of the most important criminogenic needs. The fact is, the research is clear that attitudes, companions, and personality are the most influential criminogenic need. Effective interventions often work through these needs, even when dealing with the lesser needs. The cause for confusion is that lesser needs are easier to identify and tend to be fairly prominent. Unemployment and a positive urinalysis. They're easier to deal with referrals. They're easier to deal with because addressing someone's cognitions is hard. Making a referral to a alcohol and drug group is the easy thing to do. And sometimes we confuse correlation with causation. And those of us who get the research understand the difference between correlation and causation. One thing I like to say here is there are many alcoholics that go home after drinking a lot and commit domestic violence. Well, if you only treat the alcohol problem, what you get in the long run is a sober person that still thinks it's okay to go home and commit domestic violence. So you must address the antisocial attitudes and values and beliefs, because those are the primary drivers of crime. Not to say that the lesser criminogenic needs are not important, because they are, but where you see the greatest impact in reducing crime is when you address those areas, those top areas of criminogenic need, those top 3. The 4th top area, they're oftentimes called the big 4, is criminal history, but we don't talk about that in this context because criminal history is static. It cannot be changed through a correctional intervention. One's criminal history is always going to be one's criminal history. Another example of addressing lesser needs by way of the top needs. You work with an offender to get a job. That's what a lot of us do. A lot of us practitioners do. His attitude, he has a poor attitude about work. His personality is that he often reacts poorly when he's the subject of constructive criticism. And his friends give him a hard time about not being able to hang out with him due to his work schedule. Oh, you ask yourself, how long does this person keep his job? Probably not long. So you need to address the more influential needs with interventions such as a cognitive restructuring intervention to address his attitude, to address his poor attitude, to address his antisocial personality, and possibly a structured skill building exercise to increase his job retention. We find that with technical parole violators come out of prison with a lot of unrealistic expectations. And we find that reentrants can oftentimes get a job, but they cannot keep that job because they really don't know how to take instruction. They don't know how to play well with others. They don't know how to follow instructions, like I said, and they end up losing that job. They end up losing the job. So cognitive restructuring and structured skill building to address those antisocial attitudes and personality is really where you want to focus your efforts. Okay, another myth. Programs that focus on important humanistic factors and considerations are effective. The fact is, unless a program targets a criminogenic need, it will probably not impact recidivism. The causes of this confusion: programs that often seek to improve non-criminogenic needs have a feel-good appeal. Reading, fitness, parenting, they have a feel-good appeal. Many certainly can have desired benefits, but reduced recidivism is not one of them. So teaching an offender how to balance his checkbook, let's say, everyone needs to know how to balance a checkbook, but it's not going to reduce recidivism. What's going to reduce recidivism is what? Addressing those antisocial cognitions. That's what's going to reduce recidivism, changing the way a person thinks. Responsivity myth. For some offenders, just addressing specific responsivity issues such as motivation and self-esteem will reduce recidivism. The fact is that criminogenic needs and responsivity issues often coexist, and they can and should be addressed simultaneously. The cause for the confusion is because criminogenic needs and responsivity issues often coexist. The responsivity issue may also be so apparent that it appears more important than a criminogenic need. Generally, we see this with employment and housing especially, because they are many times crisis issues that need to be addressed. Potential outcomes of addressing responsivity without addressing criminal attitudes. Motivation. What do you get? You get a more motivated criminal. The outcome, person could go on a crime spree. Self-esteem. A lot of times people will say, well, we need to enhance one's self-esteem to reduce recidivism. What you get is a more confident criminal. Could lead to a gang leader. Mental health, not a criminogenic need. It's important, but not a criminogenic need. You generally get, at the end of that, a criminal mastermind. Physical health, you get a healthier criminal. You get an enforcer. So this is just offered as an example of sometimes what we see when we address responsivity without addressing the cognitions, the antisocial cognitions resulting from criminal attitudes. Again, just to summarize this part, the risk principle: who to target, higher risk offenders. The need principle: what to target, an individual's criminogenic needs, focusing on the big three of criminal attitudes, antisocial personality, criminal values, and companions. The responsivity: how to target, using cognitive behavioral methods, matching the interventions relevant offender characteristics that impact their openness, participate, and benefit in treatment. So it's matching one's learning style. And what contributes to that? It's those things, those responsivity factors like gender, culture, right? It's those things that influence learning. Some of us are visual learners. Some of us are auditory learners. You know, it's addressing your intervention, your cognitive interventions, to those responsivity factors related to how we deliver the interventions. And that is my name, and any questions on the first two parts of this, my information there.